everyone, this is Dr. Abby from Rochester Chiropractic and Wellness, and this morning I just wanted to go over a little bit about what the Webster Technique is. We've had a lot of people coming into our office asking about that lately, and also a lot of new pregnant mamas coming into our office as well with questions about that, and either they've been referred in after they have talked to a friend or been on a group on Facebook or even done a quick Google search after they've been told that their baby is breech. So I just want to go over what the Webster Technique is, and then we've got one of our beautiful pregnant mamas here in the office this morning to help us demonstrate what we're actually doing. So to start with, the Webster Technique is a specific chiropractic analysis and adjustment that's really focused on what the sacrum is doing. So the sacrum is a bone in the middle part of your pelvis here, and we're really focused on reducing the effects of the subluxation in that bone, and then also SI joint dysfunction. And that can also improve the function of the pelvis. So essentially, when the pelvis is functioning normally, the uterus can get into proper positioning, and then the baby can also get into proper positioning. So to start with, the first part of the technique is having the patient prone. So we're focused on what the sacrum is doing. And in our office, we've got a table that drops away to accommodate the pregnant belly. And then we also use the pregnancy pillows to just make it more comfortable to lay on your stomach. So we're going to start out at the foot end of the table and take a look at what the legs are doing. So the first part is bringing the legs up, and then I'm pushing on the feet with equal resistance side to side and testing to see which one doesn't move as far towards the buttocks as the other. And in her, I'm seeing that the right side does not want to push as far or has more resistance. So I'm not going to adjust her on Facebook today, but where I would adjust is in the sacrum. So that resistance, more so on the right side, tells me that the sacrum has some rotation in it. So my adjustment is going to correct that. So I would adjust her on this right side, and then we would come back to the feet and then do the same thing, testing that resistance again. So the adjustment itself should correct that rotation, and then the resistance should be even side to side. So the next part is going to be having the patient roll over, and we're going to take a look at the ligaments. So there's a few ligaments that essentially secure the uterus inside of the pelvis and allow it to not be just free roaming in there, and increased tension with twisting or torque in the pelvis can really impede the amount of movement that baby can have within the uterus. All right, so I'm going to have you push up on all fours. And roll over onto your back. So we are going to take a look at the tension of the ligaments on both sides. We're looking particularly at the round ligament right now. And typically speaking, the opposite side of where we adjusted is where we're going to have the more tense ligament. So on her, I find it on the left side, which is the opposite side of where I would have adjusted. And then I'm just going to hold a light sustained contact until that tension releases. Good. And that's the technique in itself. So here in our office, we believe that chiropractic is safe and beneficial for pregnant women. Women under chiropractic care during pregnancy often notice decreased labor and delivery times, decreased need for intervention, and overall are just much more comfortable during pregnancy. Dr. Beth and myself are both certified in the Webster Technique, so if you're local to our area, we are one of the certified providers. There are also a few others in the area as well. But if you're not local to the area, you can check out the International Chiropractic Pediatric Association's website, which is ICPA4kids.org. Click on Find a Provider, and then you should be able to type in your contact information or where you live, and then be able to find a provider near you. Thank you for watching this morning. If you found this information beneficial, pass it on to someone that you may know that needs to hear about it as well. Have a great day.